Welcome to a new episode of Dil Ke Doubts by the Heart Health India Foundation. Heart Health India Foundation, or HHIF, is India's first patient-led CBD patient and caregiver support organization. Our three areas of work are awareness, support, and advocacy. We currently have a patient community of over 3,000 members across India and a volunteer community, which includes students, healthcare professionals, and more of over 300 members. Dil Ke Doubts is one of our podcasts and key initiatives, which focuses on raising awareness and bringing relevant health information from various healthcare professionals to our heart health community. So on today's episode, we are honorably joined by Dr. Aastha Dhingra, who is a Gurgaon-based clinical psychologist with over 12 years of experience in mental health and behavioral sciences. She's a former assistant professor at SGT University in Gurugram and a member of the Juvenile Justice Board of Gurugram. She has served as a trusted expert for leading national platforms like Times Now, NDTV Prime, Disha TV, Aaj Tak, and India Today. She has a proven track record as a trainer and consultant. Dr. Aastha has delivered impactful programs for educational institutions, corporates, and organizations all across India, focusing on mental health, emotional intelligence, and leadership development. She has also authored and edited 3 books and has published over 40 papers in national and international journals. Her expertise is frequently sought for guidance on psychology, career advice, and mental well-being. Dr. Dhingra specializes in helping professionals across various life stages enhance their sense of purpose, well-being, and productivity. Her contributions have been recognized by various institutions, including the Gurgaon District Administration. So we're very happy to welcome Ms. Dhingra, Dr. Dhingra, today on our podcast, where our conversation will focus on the intersection of clinical psychology as well as heart health. So thank you, Ms. Dhingra, Dr. Dhingra, for joining. I apologize for this.
Thank you so much, Tanushri. Thank you so much. I would like to thank you for following up for such a long time. I know I have postponed it for a while now. And thank you, Heart Health India Foundation, for considering me credible enough to be able to contribute to some sort of awareness in collaboration of mental health with cardiac related issues. So hats off to you for even thinking about this. This collaborative thought in itself is going to make a huge impact, I'm sure. So thank you so much for inviting me and having me here.
Thank you so much for just joining us. I think we'll learn a lot of insightful information today. I can already see from your introduction that you, I'm sure, have lots of experience and expertise that will guide us. So I'll begin with a very simple question. So when we first have a heart episode or a heart condition, people usually think of it as a very physical disease. You know, your heart has either stopped working or blood flow is lower, something or the other. People treat it as a very physical health issue. I think mental health related to heart health issues is kind of put on the back burner. So why is it important for heart patients to address both mental and physical health when it comes to, heart health? And how can considering mental health in their recovery process influence their outcomes?
Okay, so it's been almost 13 years of my practice now, and one thing that I can confidently say here today at this platform is that mental health has profound impact on the heart health and its recovery. I've had a lot of patients coming up, opening up issues related to the cardiac areas. So, see, emotional stress, anxiety, depression, these are not just psychological issues. They have real and they have measurable effects on your cardiovascular health as well. See, it's very important to understand that your mind and your body are interconnected. We all know it, but we fail to acknowledge it. And a small disturbance in the mental state can directly influence the heart's functioning and thereby the entire body, right? Let's understand this scientifically. So whenever we have a chronic stress or whenever we have any stress, it releases a hormone called cortisol. Now, the function of the cortisol is to increase the blood pressure. It increases the heart rate and it causes inflammation. And these are the factors that are directly contributing to heart disease, right? Even the American Heart Association also have there in their literature that individuals with depression are 64% more likely to develop CHDs, the coronary heart diseases, the coronary artery diseases. So there are, I think it's high time when we all should recognize that it's kind of, coordinated and interrelated thing. So it's not only कि अगर heart issues हैं तो सिर्फ it's only a physical thing. It has a lot of psychological implications, and the psychological implications are also related to heart issues. It's vice versa as well. So when we talk about the mental health issues, I think there are I can actually suggest few signs to watch out in all the heart patients. So if you see that there is prolonged sadness, there is hopelessness. So if you see कोई heart patient है जो बहुत persistently sad महसूस कर रहा है, काफी time से hopeless है, I have had a cardiac arrest, and then life is very short, which in front of me now. I have a lot of responsibilities. People do think of all these things. Yeah. This could actually indicate depression, and this is a known risk factor for worsening of the heart health. Then you have anxiety, you have panic attacks, you have particularly sleep disturbances. And if you see that there is a loss of interest in activities that was previously or earlier very pleasurable, कोई आपकी hobbies हैं, कोई आपके interest areas हैं जिसमें अचानक से आपका interest खत्म हो गया है, there is a noticeable withdrawal. So, these are the watch out signs. These are the alarms or the warning signs that if you see in yourself, it can result to cardiac arrests as well. So it's very, very important. So I remember, if we have time, I think we can, can I share some cases that I've actually seen?
Yeah. Go for it.
Yeah. So I remember I worked with a 58-year-old patient who survived a heart attack, and he was very non-compliant with the post-op the rehab, right? Because unko severe depression tha. There was lack of motivation and this constant fatigue, which made him actually skip the exercise part, the rehabilitation sessions part, and he never realized that this actually delayed his recovery. So when we intervened as a psychologist, when I intervened through psychological interventions like, CBT, right? Cognitive behavior therapy, we applied some techniques of CBT and he became more engaged. And we suddenly see that there was changing, the positive changes started happening, and he started to significantly improve his condition. So in short, what I want to say is that mental health is not just an added concern. It's actually central to both preventing the heart disease and also ensuring the full recovery, I would say.
Yeah. I think that is a good message to take on, to really integrate mental health not as something separate, but key to making a full recovery. So I have just a few quick follow-up on this part. So you mentioned, prolonged sadness or a noticeable disinterest in activities. So sometimes, patients who have just had their surgery or procedures would consider that, oh, this is very normal. I've just gone through a very significant event. So what is the line between the normal level of sadness or normal number of days where you feel sad or loss of activity interest versus this is the point where, intervention is needed? How can patients or caregivers keep maybe a time period in mind or a specific I don't know, factor that they should consider, like, oh, this is normal, but this is not normal?
So we in our terms call anything as deviating from normal when the three major areas of your life start to suffer: your personal life, your professional or academic life. Okay, because
Yeah.
cardiac arrests are not limited to adults these days. Even
Yeah.
even children are having, even early adulthood also is facing a lot of cardiac related issues. And if your social life, these three areas in your life start to hamper, then it is alarming, and then it means that you have already deviated yourself from the normal functioning of life. If you are not able to carry out your activities of daily living, you're not able to get up from the bed, you're not able to freshen up yourself, there's no willingness to brush your teeth, take shower, dress up, look good, uh, have some self care things to be done. So अगर आपका इंटरेस्ट इन सब चीजों में कम होने लगता है या खत्म होने लगता है, I think that's the time when it's alarming. You are somewhere on the border of moderate depression, or maybe you've reached a severe depression stage.
Got it. Okay. And as you brought up, heart episodes are not something that are, an old age disease anymore. It happens all across to everyone. It's a silent killer, and it just comes up and shocks you. So my question is, do these signs, or are there any key things that differ across demographics like age or gender when it comes to recognizing, oh, I might have a mental health concern?
Not really, because these days, if you see, the lifestyle changes are so drastic, and so I generally have clients walk in with like, I visit hospitals. I'm a consultant with many hospitals. So जब हम rounds लेने जाते हैं ना, तो हमें हर age group का कोई ना कोई age group का मिल ही जाता है with cardiac issues, or maybe just survived a heart attack, or maybe I remember very recently I was doing my rounds in a hospital, and I see a very good body built, a healthy looking guy, probably would be in his 28 years or 30 years of age, जो वहां उस hospital में stand डलवाने आया हुआ था, because there was blockage. And that blockage, when he was referred to me, was because of his inability to manage work-life balance. A lot of responsibility from the family side, and then he started off with some of his business, and his partners withdrew, and there was so much of pressure that there were sleepless nights. So I was just wondering, a 28-year or a 30-year-old, almost 90% blockage, had 2 stunts, how much would he survive? Because taking counseling is also a taboo.
Yeah, for sure.
हम जब काउंसलिंग लेने जाते हैं तो सबसे पहला क्वेश्चन ये होता है कि यार हमें कोई दिक्कत हो रही है. We forget that it's also for our well-being.
Yeah.
So we enter into depression, that we have had a cardiac arrest, अब तो जिंदगी बहुत कम बची है. We start to think about, after me what is going to happen, and that's where we take a downward fall. So ये कुछ चीजें हैं जो हमें ध्यान रखनी चाहिए. So there is no particular demographic area wise things, or probably I would say जितनी भी हम अब progressive states, cities hain, there is a lot of pressure. There's a lot of pressure, people say, in corporate, but I see similar pressure in some government agencies as well. So it's actually the work pressure, and how do you cope with it? So we actually fall prey of faulty coping mechanisms. हमें इतना ज़्यादा आजकल की generation के साथ सबसे ज़्यादा हो रहा है, because everything has been spoon fed, everything has been readily available for us. We actually look up to very fancy jobs offering us lakhs of rupees per month, and then we fail to understand that to be able to earn that much, you have to compromise a lot.
Exactly.
अगर आप 5 लाख की, 6 लाख की, 10 लाख की सैलरी ले रहे हो, So don't forget that the organization is going to ask for work equivalent to double the amount of your salary. Then you have to compromise and sacrifice a lot on your personal life. And when you lose the support system, your family, your friends, your social circle, there is that is the time when you start falling prey of depression, of anxiety, of stress. So we should always keep a balance. We should always know what are our short-term goals, what are our long-term goals, to be able to avoid such conditions, at least to come so early in our life.
Yeah, I think that's really meaningful advice. And I actually want to ask you a quick follow-up on this part since you brought it up. It's like, the newer generation, we talk, or the word mental health comes up more frequently now. We think that we have gone past the age where it's no longer a stigma or a taboo to discuss mental health or, go for therapy and so on. But I think that's something that we just say, but it's not something that we internally, realize and so on. So are there any insights that you can offer on how to get out of that mindset, that this is not really that something ki aapko taboo ke andar, you just have to live in that house that, oh, this is something shameful or something. Like, how do we make physical health and mental health equally important in our lives without that stigma following us?
See, physical health and mental health are actually equal. Rather, अगर आप देखें तो हम mental health को ज़्यादा importance देनी चाहिए, because अगर वो खराब होती है तो physical health automatically खराब हो जाती है. Right? So, coming back to your answer, stigma remove karna will take a lot of years, right? But thankfully, when you talk about counseling, these days, even I have seen this trend. I am on a couple of online platforms, as well as I visit a couple of hospitals as a consultant. My visit I found is useless because I hardly get to see 3 to 4 walk-ins. But if you count my online consultation, probably in last 6 months, or I would say 4 to 6 months span, I would have crossed more than 250 patients. They would not need to come to me for follow-ups, but just hearing them out for n number of reasons, because they don't have anyone to speak to, and they don't have anyone who would love to listen to them unbiased, non-partial, non-judgmental, and just listen. So at times I just have to sit like this and just listen. Okay, 45 minutes. Listen, the time is going up. So let's cut it short. If it's okay, we can book another session. Allow me some time. I have another patient. So I have to actually build up like that. Yes. So yes, there are. So this what does this reflect? This reflects that there are a lot of people out there जिनको सिर्फ physically आने में दिक्कत है. कि I always tell people, we are more scared of what will those 4 people who will look around will say. वो 4 लोग क्या कहेंगे? It has become more than depression or more than any other problem. This has become the major problem. And these 4 people are the people until your death, you will never see them. Even after your death, you will never see them. When you'll ghost around also, you will never see these 4 people. But still, the entire life, we are just worried about these 4 people. These 4 people only give us the cardiac arrest. We don't know what our boss is judging, or what our boss thinks about us, or our parents think about us, or our siblings think about us. But we assume that in front of those 4 people, if they say like this, my repute is gone. And hence it triggers your anxiety, and hence it leads to cardiac arrest. So yes, breaking the stigma, one, these online platforms are working really good. People are coming in, talking to us through these online platforms, and hence these online platforms आजकल बहुत बढ़ गए हैं. There are many online platforms that are available. Make sure that you reach out to a psychologist. If not just drop in or walk in a hospital setup, at least through this. Read more about your health issues. I would say do not Google much, because Google पे जितनी भी information होती है, not necessary वो किसी expert psychologist, clinical psychologist, किसी psychiatrist ने लिखी हो. It can be written by any layman. So there are technically a lot of sites, like you can refer to American Psychological Association, you can refer to British Psychological Association. So there are a lot of technical, authentic sites. If you don't want us to help you with counseling, at least reach out to us so that we can provide you with the right content. हमारे पास कई पेशेंट्स आते हैं जो सिर्फ इतना कहते हैं कि ये 10 थेरेपीज कर ली हैं बिकॉज गूगल के हिसाब से मेरा डायग्नोसिस ये था. And thanks to AI these days, people type their signs and symptoms and ask them मेरे को क्या बीमारी है. And ChatGPT, Copilot, other apps tell them that congratulations, you have bipolar. And then the patient starts to Google worksheets for bipolar, medicines for bipolar, and वो खुद फार्मा में जाके अपने हिसाब से डोजेज ले रहे हैं. मेरा वेट ये है, मुझे इन चीजों से एलर्जी है, मुझे कितनी डोज खानी चाहिए. They fail to read कि वो नीचे लाइन लिखी आती है that please reach out. This is just a disclaimer.
Yeah.
So we are doing a lot of things that's haywire, and we really need to systematize. We really need to structure in order to break the stigma.
Yeah.
So please read out proper information, get to the psychologist. We are also well-being coaches. We are going to help you with your lifestyle changes. We just are not limited to identifying what problems you have. And trust me, we are the best ones to help you come out of any situation. कोई भी ज्ञान आपके इतना काम नहीं आएगा जितनी टेक्निकल इंफॉर्मेशन आएगी, ताकि आप जल्दी उस सिचुएशन से बाहर आ सके, so that you don't lose on your productive years when you could have done much better. Yeah.
I think I must echo this message. You know, I have for some projects I've read through the DSM-5 and I've talked to a lot of clinical psychologists about this area too. And there's definitely so much criteria that, you know, you have so many factors that you look through when you're trying to diagnose a patient, and still it's not always black and white. A lot of the diagnosis comes from the clinical psychologist's long years of experience of seeing patients on the daily that helps them recognize, oh, in this context, this is what you have. So definitely,
I would like to raise one more point here, which probably is also, which also adds to the stigma part, is that we psychologists charge a hefty amount. But I would like to raise one thing here. Say suppose you go to a physician, or you go to any OPD, any doctor's OPD, the doctor might charge you in the bracket of 800 to 2000 for one visit, right?
Right.
इससे ज़्यादा मुझे नहीं लगता OPD में कोई इतना ज़्यादा चार्ज करेगा, unless you referred for some tests or some follow-ups or something. That doctor only sees you once for 10 minutes. वो भी मैं मैक्सिमम बोल रही हूँ. 10 मिनट भी बहुत मुश्किल होता है कि कोई फिजिशियन या कोई एक्सपर्ट डॉक्टर भी आपको बिठाए. You are ready to pay them an amount of 2000 maximum. But a doctor like us, who are actually working on the root cause of your problem so that this problem never ever appears again in your life, these symptoms, we train you in such a manner, and we spend about an hour with you in a counseling session, not just 5-10 minutes and telling you ye mat khana, ye is time khana, ye is time pina. Right? I'm not trying to disrespect any doctor's community per se, but what I'm trying to say is people have this in mind कि psychologist ने 1200 charge किए, 2000 charge किए, किया ही क्या था, बातें ही तो की थी. And you see that those बातें also are making so much of impact in your life. So that means हमारी बातें भी काफी technical होती हैं. We just don't talk. We talk sense. And that is the only difference.
I think this is a good message to take away. It's not just about the money, but think about what you're getting out of that.
Yes.
talk. So thank you for offering that insight. So now that we've kind of settled on this is the status, this is how it connects, let's get on to talking about some practical strategies. So what are some of strategies that clinical psychologists offer to patients so that they can better manage their stress, anxiety, or depression during the recovery process?
So there are a lot of things that probably I do in my clinics and with my hospitals. जब भी इस तरह के केसेस आते हैं ना, तो सबसे ज्यादा जो मैंने महसूस किया है आर इमोशनल चैलेंजेस जो फेस होते हैं, which every client faces, right? So I do a lot of CBT, cognitive behavior therapy, जहाँ पर managing their anxiety, managing their depression or depressive symptoms plays a prior role. So कहीं ना कहीं with CBT, it helps patients. It has in the past also helped my patients identify their negative thought patterns, and जिससे शायद उनका जो स्ट्रेस है, जो उनकी एंजाइटी है, उसको हम रिप्लेस करते हैं with more healthier, with more realistic ways of thinking. So like अगर आप हार्ट पेशेंट्स की पर्टिकुलरली बात करो, तो CBT can focus on breaking the cycle of the catastrophic thinking that they have. शायद अगला हार्ट अटैक ना आ जाए, शायद अगले हार्ट अटैक में डेथ ना हो जाए. So which can actually lead to heightened anxiety की थोड़ी सी एसिडिटी भी हो रही है, तो ऐसा लग रहा है, oh my god, बस हार्ट अटैक आया. That's what happens, right? So I remember I worked with a heart patient who was constantly worried about another heart attack, and it led him to a lot of anxiety, and वो इस वजह से रात को सो नहीं पाते थे. उनको बहुत इंसोमनिया होता था कि अचानक से उठ रहे हैं, रात को वॉक कर रहे हैं कि डॉक्टर ने कहा था वॉक करनी है, तो मतलब एक्सेसिव वॉक भी नहीं करनी है, बट देन बिकॉज ऑफ दिस ही हैड इंसोमनिया. So now with CBT, we worked on reframing his thoughts. He learned to replace all these irrational fears and of a looming heart attack with the understanding that by following the medical advice and by following what the thought alternatives, the positive ones are suggesting them, he was actually very actively being able to reduce his risk. So as a result, उनकी anxiety भी decrease हो गई, and कहीं ना कहीं he started taking control on his life all over. Then we also do a lot of mindfulness based stress reduction therapy, जिसमें हम रिलैक्सेशन सिखाते हैं, बट माइंडफुलनेस सिखाते हैं पहले, कि आप कैसे सारी चीजें भूलकर प्रेजेंट में स्टे कर सकते हो. इससे वो अपना स्ट्रेस अच्छे से मैनेज कर पाते हैं, ताकि जितने ये ओवरवेलमिंग थॉट्स उनको आ रहे हैं अबाउट द फ्यूचर, अबाउट द पास्ट, they stop coming and they are more focused on what do they have in present to offer them. So also I have seen a lot of times that with deep breathing, with meditation, with progressive muscle relaxation, the JPMR part, again it's a part of MBSR, the mindfulness thing, it has shown significant impact by lowering the blood pressure, by जो हार्ट बीट होती है वो रिड्यूस रहती है, इमोशंस आपके काफी रेगुलेटेड रहते हैं. So mindfulness has done wonders for my patients particularly. So I'm just speaking about my experiences and what I generally do with heart related patients. Then a lot of relaxation training is required, so it's kind of connected. Mindfulness में भी हम JPMR कराते हैं, so progressive muscle relaxations, deep breathing again. Then there is a lot of behavioral activation activities that I do. So what I do is it's a behavioral activation wherein it encourages patients to to engage in small activities, जहां पर छोटी छोटी चीजें जैसे वॉक करना, गार्डनिंग करना, if you want to listen to some songs and just with some movement, some body movement, चाहे ऐसे ऐसे कर लो, चाहे ऐसे ऐसे कर लो, bit of movements. So I often start with the low impact activities, जैसे वॉक करना है, गार्डनिंग करना है. एक होता है चेयर पे बिठाकर, I make them sit on the chair and do simple yoga, like just movement of left leg, then movement of right leg, then movement of arms like this. So this has seen to improve their mood, because at times it feels very stupid, at times it feels very silly of what you're doing actually, and then that brings a smile, and then you tend to engage yourself in physical exercise. So again the best part of heart health, physical exercise is important. So yeah, these are certain things that I do, I practice, and I really work a lot on the sleep disturbances. So I teach them the sleep hygiene. They have to sleep on a regular time. The time should be, adjusted. Plus minus 15 minutes are okay. अगर उनको नींद नहीं आ रही है लेटने के भी 20 मिनट बाद, तो कौन सी एक्टिविटीज हैं जो उनको करनी चाहिए, कैसे कैसे लाइट को डिम करते रहना चाहिए विद द पैसेज ऑफ टाइम. दिन में बहुत रोशनी रखो सो दैट योर आईज आर एक्टिवेटेड. धीरे धीरे जैसे जैसे रात होती जाती है, keep dimming your light so that even your brain gets an idea that you are reaching a time to sleep. So yeah, all these time, avoid caffeine, try to read something rather than avoiding screen time. So avoid screen time 30 minutes prior you sleep. So all these things are something that I generally do with my clients.
I see. Thank you for sharing. I think these are some gives a big idea of what is generally involved in when you visit a clinical psychologist. So thank you for sharing the tips and what you do.
Pleasure.
I want to shift the focus a little bit from the patient to the caregiver. So caregiver burnout is a problem that is being discussed a lot more. Obviously, it's the patient that goes through the procedure, the surgery, or so on. But a lot of the burden and a lot of the care that is given, hence the name caregiver, is falling upon the family members or the friends around them, their social support. So, what are some of the emotional challenges that these caregivers face, and then how can people like you, a clinical psychologist, help prevent some of the issues that they face?
Oh yes, the role of caregiving, according to me, it comes with a high level of responsibility, with a lot of emotional strain, and often I would say physical exhaustion. And over the time, these stressors also takes a serious toll on the caregivers' mental health, physical health. It leads to emotional fatigue, and कहीं ना कहीं उनको भी एक लेवल पर आकर बहुत एंजाइटी या बहुत डिप्रेशन या रिजेंटमेंट सी फीलिंग आने लग जाती है. सी अगर आप इमोशनल चैलेंजेस की बात करो तो एक केयर गिवर जो इतने टाइम से एक पेशेंट का ध्यान रख रहा है, उसको कहीं ना कहीं कांस्टेंट वरी है. there is an anxiety often consumed by the fear that their loved one might experience another heart attack, another heart event, or maybe any complication because of this, any other health issue because of this. And this again is a spiral. It leads to anxiety. So they may always feel like they're on the edge, always waiting for अभी हुई नेक्स्ट इमरजेंसी, अभी हुई नेक्स्ट इमरजेंसी, और उससे उनका स्ट्रेस लेवल बढ़ जाता है. कई बार जो केयर गिवर्स होते हैं वो बहुत ज्यादा ओवरवेल्म्ड होते हैं, एंड उससे वो एग्जॉस्ट हो जाते हैं. उनके पास पर्सनल रिस्पॉन्सिबिलिटीज तो किसी के पास भी कम नहीं है. यू हैव टू हैंडल सो मेनी थिंग्स, एंड ऊपर से एक्स्ट्रा रिस्पॉन्सिबिलिटी एडेड, एंड हेंस इट लीड्स टू एग्जॉशन. सो this juggling with multiple roles अपने आप में ही काफी ज्यादा इमोशनल प्रेशर एंड फिजिकल डिमांड्स लेकर आता है, जो एक केयर गिवर के लिए एक बर्नआउट सिचुएशन, बाय द एंड इट लीड्स टू अ बर्नआउट सिचुएशन. Then few of them have also reported some sort of guilt which with time develops, and there is a lot of self blame. Now why is that so? There is a constant feeling कि मैं शायद और अच्छा कर सकता था. They aren't doing enough, they are not caring enough. शायद मैंने अच्छा ध्यान रखा होता तो कार्डियक अरेस्ट होता ही नहीं, राइट? एंड इस चक्कर में वो अपनी हेल्थ को साइड में कर दे. सपोज इफ इट्स माय स्पाउस, if it's my father, if it's my mother, I would think I've not been a good child. I think they needed me. and then वो स्पाइरल स्टार्ट हो जाता है, वो गिल्ट का सर्कल, वो सेल्फ ब्लेम का सर्कल स्टार्ट हो जाता है कि most I have seen with many daughters coming up जिनके फादर को या फादर इन लॉ को कार्डियक इश्यूज थे, एंड दे थिंक शादी के बाद मैं अपने डैड का ध्यान ही नहीं रख पा रही हूँ. I would have given much time to him. Probably he wanted to just vent out. So yes, there is a lot of guilt, there is a lot of self blame, and because of that हम जो अपनी बेसिक नीड्स होती है ना केयर गिवर की, हम वो भी निग्लेक्ट कर देते हैं. हम बिल्कुल भूल जाते हैं that we exist. And this is where, as a psychologist, I intervene, saying that it's you. If you will not be able to survive longer, if you will not be able to take care of your own health, this guilt, don't you think, will continue for a longer time? आप ही को आज फीवर हो गया, आप ही को कोई इन्फेक्शन हो गया, at least now your father needs you. So you have to be here. So take good care of yourself. Don't avoid your meals. Don't avoid your water intake. Don't get dehydrated. Don't just stress yourself. आपसे जितना ध्यान रखा जाता है उतना करो. I think that's more important rather than stretching and then, I generally joke upon it. I make mockery of it, saying, ऐसा ना हो इस बेड के साथ आपका बेड लगाना पड़े and then आप दोनों का ध्यान रखने के लिए किसी तीसरे को गिल्ट में लाना पड़े. That's also very common. That happens in Indian society, so it's very, very common. हम अपने आप को बिल्कुल भूल जाते हैं और हमें लगता है कि अगेन वो 4 लोग क्या कहेंगे कि फादर बीमार है फिर भी नौकरी कर रही है, फिर भी अपना बच्चा देख रही है, फिर भी अपनी फैमिली देख रही है. अपनी नहीं देखेंगे, अपने आप को नहीं देखेंगे. I literally made that daughter जिनका मैं डिस्कस कर रही थी अभी आपसे केस, I made her sit and listen to her favorite 10 songs. I gave her 30 minutes and with the headphones, properly made her sit in my own room, and I asked her, आप जब relax होंगे आपको तभी allowed होगा वहां आना. Because जो patient होता है ना, वो आपकी anxiety को भी infer कर लेता है. आप ये नहीं समझ रहे, वो patient और deteriorate होगा. आपके guilt से patient को भी तो guilt हो रहा है ना, कि मेरी वजह से देखो इसको भी सफर करना पड़ रहा है. You're adding on the guilt. Rather, you should be more reassuring, saying, I'll take care of myself. I am okay. एक fruit मैं खा रही हूँ, एक fruit आप खाओ. How about that? That's a good deal to do. That's a good deal to make, right? आप पानी पियो, चलो मैं भी पानी पीती हूँ. अच्छा, you have medicines to take. Oh shit, I also had medicines to take. Let me also take my BP medicines, my diabetes medicines, or I was supposed to give some calcium supplements to my mother-in-law. Okay, give me just 30 minutes, I'll be back. So you are taking care of everything, but in a coordinated, synced, and an organized manner, balancing everything. So I think that's somewhere which is very, very important. And you should not feel isolated. You should not feel lonely. There is a lot of resentment and frustration also that happens. So I use initially a lot of stress management techniques. Again, relaxation works. But here, with all this, I encourage all the caregivers that I come across to create boundaries and the self-care part. Because I truly believe you can't pour from an empty cup. So you need to take care of yourself. You need to come out of that guilt, that resentment. So, you need to talk it out. You need to adopt a lot of practical coping strategies. You need to manage your time. You just don't need to give all the time to the patient. That's also not healthy for you. So yeah, that's all what I do.
Thank you so much for talking about this topic in such depth. I think the message and the content that you talk will stick with our patient and caregiver community a lot. So I think very insightful. Thank you. And I'm